Hello, thank you so much for joining me today. My name is Melissa Devine. I'm with the Medicare Medicaid Assistance Program, also referred to as MAP, through the Area Agency on Aging 1B. Today we're going to go over Medicare's coverage of vaccines. Let's get started. Today we're going to cover who MAP is and what we do, and we're going to cover vaccines. What's Medicare's coverage? What vaccines are covered specifically by Medicare Part B? And what vaccines are specifically covered by Medicare Part D. MAP Inc. MAP counselors are certified and have been trained in healthcare benefit counseling. This includes Medicare, Medicaid, and other insurance products. MAP counselors are not connected with any insurance company, and they are not licensed to sell insurance. In many states, the MAP program is called the SHIP program, the State Health Insurance Program. But we're comprised of unbiased counselors located all across Michigan and offering free health benefit counseling assistance. We want to help empower and educate those who utilize Medicare and Medicaid in making those healthcare decisions. So how can a MAP counselor help you? We can help you understand Medicare health plans, compare and enroll in Medicare Advantage coverage, compare or enroll in Medicare prescription drug coverage, identify and report Medicare and Medicaid fraud and scams, and assist with enrollment into low-income programs. Now let's take a minute to understand what Medicare is. Medicare is health insurance for three groups of people: those that are 65 and older, those under 65 with certain disabilities, and those of any age with end-stage renal disease. It is administered through the Centers for Medicare and Medicaid Services, and enrollment into Medicare takes place through the Social Security Administration for most and the Railroad Retirement Board for railroad retirees. Medicare has well-defined benefits and exclusions. It does not cover dental, hearing, or vision care except under special circumstances. It does not cover long-term custodial care. It does place limits on certain care items such as physical therapy and durable medical equipment, and it does not cover over-the-counter medications. Medicare does work with private insurance companies to provide Part D prescription drug coverage, supplemental plans or Medigap plans to help fill in the gaps in the original Medicare costs, and Advantage plans which combine parts of original Medicare, usually with prescription drug coverage, and often some dental, hearing, and vision coverage. There are four parts to Medicare: Part A, hospital insurance; Part B, medical insurance; Part C, Medicare Advantage, which are plans like HMOs and PPOs; and Part D, Medicare prescription drug coverage. Now let's take a look at the Medicare vaccine coverage. Medicare covers all sorts of vaccines. You have coverage for the flu vaccine, the tetanus, diphtheria, pertussis, also known as a DTaP, the pneumonia vaccine, the shingle vaccines, and even some additional vaccines like your MMR, measles, mumps, rubella, or your hepatitis. It also covers the COVID-19 vaccine, including the boosters. As always, we recommend, though, that you consult with your doctor or pharmacist on what vaccines may be recommended for you. Now, there are certain vaccines that are going to be covered under Medicare Part B, so let's take a look at those. Influenza is also called the flu. It's a virus that can cause fever and other symptoms. Flu shots can help prevent seasonal influenza. Medicare Part B covers one flu shot every flu season, including the high-dose flu vaccines. And the flu season usually runs from November through April. So depending on when you choose to get your flu shot, Medicare may cover a flu shot twice in one calendar year. For example, if you get a flu shot in January, let's say 2022, during the flu season, you could get another shot November 2022 for the following flu season. If you qualify, Original Medicare covers the flu shots at 100% of the Medicare approved amount when you receive the service from a participating provider. This means that it is no cost to you, including no deductible or coinsurance. Medicare Advantage plans are required to cover the flu shots without applying deductibles, copayments, or coinsurance when you see an in-network provider and meet Medicare's eligibility requirements for that service. Pneumonia is an infection that targets the lungs and can cause fever, difficulty breathing, other severe symptoms, and death. Pneumonia shots help prevent pneumonia. Medicare Part B covers 2 separate pneumonia vaccines. Part B covers the first shot if you've never received Part B coverage for a pneumonia shot before. You're covered for a different second vaccination 1 year after receiving the first shot. You are not required to provide a vaccination history when receiving the pneumonia vaccine. You can verbally tell the healthcare professional administering the shot if or when you've received past shots. And if you qualify, Original Medicare covers pneumonia shots at 100% of the Medicare approved amount when you receive the service from a participating provider. This means that you pay nothing, no deductible or coinsurance. Medicare Advantage plans are required to cover the pneumonia shots without applying deductibles, copayments, or coinsurances when you see an in-network provider and meet Medicare's eligibility requirements for the service. Hepatitis B is a virus that attacks the liver and can cause chronic liver disease. Hepatitis B shots can help prevent that disease. Medicare Part B covers the hepatitis B vaccine if you're at medium or high risk for hepatitis B. Medicare considers you at medium or high risk if you have end-stage renal disease, have hemophilia, are a client or a staff member at an institution for the developmentally disabled, if you live in the same household as a hepatitis B carrier, have unprotected sex with multiple partners or with someone who has hepatitis B, use certain injection drugs, or are a healthcare professional in frequent contact with blood or other body fluids during routine work. Please note that if you're at low risk for hepatitis B, the shot will be covered under Part D. If you qualify, Original Medicare will cover the hepatitis B shots at 100% of the Medicare approved amount when you receive the service from a participating provider. This means that you pay nothing, no deductible or coinsurance. And Medicare Advantage plans are required to cover hepatitis B shots without applying deductibles, copayments, or coinsurances when you see an in-network provider and meet Medicare's eligibility requirements for the service. Original Medicare Part B covers the COVID-19 vaccine, regardless of whether you have Original Medicare or a Medicare Advantage plan. You will owe no cost sharing, no deductibles, copayments, or coinsurance, so speak with your doctor to learn more about the vaccine. You can also contact your state or local health department for more information as well. You should bring your red, white, and blue Medicare ID card with you to your vaccination appointment, even if you have a Medicare Advantage plan. If you do not have your card on you, your vaccine provider will ask you for your Social Security number so that they can look up your Medicare information. The Food and Drug Administration, also known as FDA, has approved an additional dose of the COVID-19 vaccine or booster for those that are at risk populations. That includes people 65 and older. The extra doses or boosters are covered by Medicare with zero cost sharing. So speak with your healthcare provider to learn more about your eligibility for boosters. Please be aware, though, that fraud and schemes related to COVID-19 vaccine are happening. A scammer may attempt to bill Medicare for a sham test or a treatment related to the coronavirus and target individuals to illegally obtain money or Medicare numbers. Remember the following to avoid experiencing fraud related to the COVID-19 vaccine. You should not need to share your Medicare number with anyone except for the trusted healthcare providers. Be wary of people who ask for your financial information. The vaccine should not cost you anything. And avoid posting photos of your COVID-19 vaccination card on social media, as that has information on it that can be used to steal your health identity. If you experience any Medicare fraud, please contact your Senior Medicare Patrol, which is MAP. We are there to help report any of those issues that would come across. Now let's take a look at the vaccines that are covered specifically under Medicare Part D. If your provider recommends that you get a vaccine, in most cases, it's going to be covered under your Part D plan or your Medicare Advantage plan prescription drug coverage. Part D plans must include most commercially available vaccines on their formularies, which is their list of covered drugs. This is including the vaccine for the shingles or herpes zoster virus. The only exception is going to be the flu vaccine, pneumonia vaccine, hepatitis B vaccine, and the COVID-19 vaccine, all of which are going to be covered by Part B, which we discussed earlier. The amount that you're going to pay for your other vaccines under Part D is going to vary depending on where you get vaccinated. Be sure to check your plan's coverage rules and see where you can get your vaccine at the lowest cost. Typically, you're going to pay the least for your vaccinations at in-network pharmacies or at a doctor's office that can do one of the following. Either coordinate with a pharmacy to bill your Part D plan for the entire cost of the vaccination process, which is the drug and its injection, or if that office can bill your plan directly for the vaccination process, including or using an electronic billing system. When you're vaccinated in either the above settings, the pharmacy or the doctor's office, you should only need to pay the plan's approved coinsurance or copay for the drug and the vaccination process. When you get a vaccine at your doctor's office, ask the provider to call your Part D plan first to find out if your provider can bill your Part D plan directly. If this is possible, you should not have to pay the full out-of-pocket cost and later request reimbursement from your plan. You may end up paying more for your vaccination if your provider cannot coordinate with a pharmacy to bill your Part D plan for the entire cost of the vaccination process, and or it cannot bill your plan directly for the vaccination process using an electronic billing system. In these circumstances, your provider will bill you for the entire cost of the vaccination, including the drug and its injection. You will have to pay the entire bill upfront and request reimbursement from your Part D plan. It is important to know that your provider may charge you more than the Part D approved amount for the vaccination, but that your plan will only reimburse up to the approved amount, and you will not be refunded for anything above that. If you have extra help through the Extra Help Low Income Subsidy Program, the federal program that helps pay for your out-of-pocket costs of Medicare prescription drug coverage, then you can go to any provider or in-network pharmacy to get the vaccines. You will be covered for your vaccination and will only be responsible for the extra help copay. However, if you get your vaccine from a provider who does not directly bill your plan, you may need to pay the entire bill upfront and then request reimbursement from your plan later. The amount that you're going to pay for your vaccine is going to vary depending on where you get vaccinated. Be sure to check your plan's coverage rules and see where your vaccine is going to be the lowest cost. Typically, you will pay the least for your vaccinations at a doctor's office that can coordinate with a pharmacy to bill your Part D plan for the entire cost of the vaccination process, or if they can bill your plan directly for the vaccination process using electronic billing systems. When you get a vaccine at your doctor's office, ask the provider to call your Part D plan first to find out if your provider can bill your Part D plan directly. If this is possible, you should not have to pay the full out-of-pocket cost and later request reimbursement from your plan. During the course of your vaccine appointment, your provider may discover and need to investigate or treat a new existing problem. This additional care is considered diagnostic, meaning your provider is treating you because of certain symptoms or risk factors. Your provider may bill you for any diagnostic care that you receive during a preventative visit. In certain situations, your healthcare provider may be unable or unwilling to submit a bill or file a claim to Medicare. Listed below are a few reasons why your provider may refuse to file a Medicare claim, along with information about what to do in each situation. Your provider may ask that you pay in full for services. If you're seeing a participating provider, ask your provider to submit the claim to Medicare. Medicare should let you know what you owe after it's been processed. You may also find it useful to contact your state's medical licensing board to report any issues. A non-participating provider is allowed to request payment upfront at the time of service. So ask your provider to file a claim with Medicare on your behalf so that you can receive Medicare reimbursement. If your provider has opted out of Medicare, opt-out providers have signed an agreement to be excluded from the Medicare program. They do not bill Medicare for services that you receive. So you should not submit a request for medical payment from Medicare for costs associated with services that you received from an opt-out provider. You are responsible for the entire cost of care when seeing an opt-out provider. If your provider believes Medicare will deny coverage, then your provider must ask you to sign an advanced beneficiary notice, also referred to as an ABN. Before signing an ABN, ask additional questions to find out whether your provider considers the service to be medically necessary and whether they will help you file an appeal. Ask your provider to file a claim with Medicare, even if they believe coverage will be denied. You will then be able to appeal if Medicare denies the coverage. Now, if your provider refuses to bill Medicare and does not specify why, a refusal to bill Medicare at your expense can be considered potential Medicare fraud and should be reported. To report potential Medicare fraud, errors, or abuse, contact the Senior Medicare Patrol or by calling 877-808-2468 or by visiting snpresource.org. Now, on top of Medicare's great coverage of vaccines, Medicare also covers wellness and preventative services. Let's take a look at those. All new to Medicare individuals get a welcome to Medicare visit with their doctor. It's a great way to get up to date on important screenings and shots and to review their medical history. The Welcome to Medicare visit is only offered within the first 12 months of getting Medicare Part B. During the exam, the doctor will review the following: your medical and social history, height, weight, body mass index, blood pressure, and a simple vision test, potential risk factors that you may have for depression, and a review of functional ability and level of safety, which means assessment of hearing impairment, the ability to successfully perform activities of daily living, fall risk, and home safety. Individuals will get advice to help them prevent disease, improve health, and stay well. They should also get a brief written plan, like a checklist, letting them know if any additional screenings or preventative services are needed. At this visit, the doctor may also refer to additional Medicare covered screenings if the referral is a result of an initial Welcome to Medicare visit. There is no cost if the doctor accepts Medicare assignment, and it is a great benefit that you can take advantage of to ensure that your vaccinations are up to date and that you have everything covered. Medicare also covers a yearly wellness visit. So after you've had Medicare Part B for longer than 12 months, you can then start getting an annual wellness visit to develop or update a prevention plan just for you. Medicare covers one annual wellness visit every 12 months. During that visit, the doctor will record your blood pressure, weight, and height, review your potential risk factors for depression, review your functional ability and level of safety, meaning an assessment of hearing impairment, the ability to successfully perform activities of daily living, fall risk, and home safety. It's also going to give you advice to help you prevent disease, improve your health, and stay well. You'll get a brief written plan, like a checklist, letting you know which screenings and other preventative services you need over the next 5 to 10 years. And you don't need to get the Welcome to Medicare visit before getting an annual wellness visit. However, if you did choose to get the Welcome to Medicare visit, you will have to wait a full 12 months before you can get your first annual wellness visit, and you'll pay nothing for the exam if the doctor accepts assignment to Medicare. So in addition to the Welcome to Medicare visit and your yearly Medicare visit, Medicare also covers a number of other preventative and wellness services. This slide details just a few of the wellness and preventative services that are covered by Medicare. Many other services are covered, such as bone mass measurement, glaucoma test, diabetes self-management training, and obesity screening and counseling. And as you can see here on the slide, our flu shot is listed here as something covered under your Medicare Part B, because as you remember, Part B is going to cover the flu shot, the pneumonia shot, the COVID-19 vaccines, and your hepatitis B shot. And just as a reminder, you should always check your Medicare summary notices regularly for any discrepancies with your healthcare services. Medicare is never going to call you out of the blue and ask for your Medicare numbers. And when it comes to COVID-19, you should not have to give your information out. No Medicare ID numbers, banking information, or credit information to any contact tracers. So if any of these situations happen, it is likely a scam. Always be sure to report incidences like this to MAP at 800-803-7174. And for resources outside of MAP, you have access to the Medicare New Book, which is sent during the fall with state-specific information, meaning it's going to show specific plans for Michigan. You should receive, again, your hard copy in the mail in the fall, but you can access an electronic version all year long online. You also have access to Medicare.gov, which is Medicare's plan finder and website, and you can always call 1-800-MEDICARE. However, for the best resource for your local Medicare information, that is MAP. Our services are free, they're unbiased, and our certified counselors are not sales agents. They're not affiliated with private insurance companies, and we can be your best resource for all questions and concerns Medicare. There's no question that's too small or difficult, and we've saved over $2 million for beneficiaries in your area. I want to thank you so much for joining me today and spending time with me to learn about Medicare's coverage of vaccines. My name again is Melissa Devine with the Medicare Medicaid Assistance Program through the Area Agency on Aging 1B. If you have any questions at all, please do not hesitate to reach out to me. My contact information is listed on this slide. You can reach me by email at mdevine@AAA1B.org. You guys have a wonderful day.